after discussing with the first segment of biochemistry, in which we covered all the metabolism, etc., enzymes, biological oxidation, now we come over to another very, very important topic from examination point of view, vitamins. Vitamins एक ऐसा टॉपिक है जिसमें मोस्ट ऑफ द टाइम मोस्ट ऑफ द क्वेश्चंस हैव बीन आस्क्ड. अब नाउ सी वी ऑल नो vitamins are the ones which are required obviously for the proper growth and maintenance of the body, and we know vitamins are of two types, fat soluble and water soluble. So here we will be starting up with the water soluble vitamins, and the most important feature of these water soluble vitamins are that they mainly acting as coenzymes. Very, very important. And water soluble का मतलब ये क्या है? They are soluble in water, so there is no need of storage, not stored, except B12. Right? And the another important feature about this is that these water soluble vitamins are of two types. एक है B complex and two types, or you can say two, or the other one is ascorbic acid. Ascorbic acid or vitamin C. Now B complex are also further divided into two subclasses, non-hematopoietic and hematopoietic. Right. अब non-hematopoietic will include B1, B2, B3, B5, B6, B7, and hematopoietic will include B9 and B12. Now what all you have to remember in vitamins, you have to basically focus on beta two things. तो active forms, two क्या, in fact three things: active forms of the vitamin, the biochemical functions, and the deficiency manifestations. Right. These are the three aspects on which you have to pay attention, you have to learn. The rest of the things are like RDA and all, RDA, and then you can say biochemical assessment in some of the vitamins because questions have been asked. Assessment. Now, first of all, we are going to start up with vitamin B1. Right, vitamin B1 is also known as, active form of vitamin B1 is TPP, which stands for thiamine pyrophosphate. Present in the polished rice and also known as anurin. Right. Up now, since this is the active form, what are the sources? Sources are very simple of TPP. I told you rice. Then you can say about the milk. Milk is there, eggs are there, green leafy vegetables are there. These are in general source of every vitamin. Now, what are the biochemical functions of TPP? The most important one, biochemical functions. Now, the most important function, since they are acting as coenzymes, just now I told you all the classes, whatever is there, they will be classified, yeah, their function will be they will act as coenzymes. So biochemical function is acting as coenzymes. Now, what are the reactions in which they are acting as coenzymes? Now, we will move on to the first reaction. Basically, always remember TPP is for oxidative decarboxylation. Oxidative decarboxylation, which is removal of carbon dioxide in the presence of oxygen. Removal of carbon dioxide in the presence of oxygen. Right. Now, what are the main 4 enzymes for which TPP is used? The first is, which is a very important reaction, and matlab, from examination point of view also, I would like to say that TPP is considered to be a very important vitamin. Conversion of pyruvate to acetyl-CoA. The enzyme is PDH. PDH, which already I have described in detail, it is an example of multi-enzyme complex. Right, and since it is an example of multi-enzyme complex, the most important vitamins are TPP, B1, FAD, B2, NAD, B3, SH-CoA, B5, and lipoic acid. But the most important one here is this TPP. PDH, because here carbon dioxide is given out. And why TPP is important? Because this is the one which will carry this, which will transport this carbon dioxide, right? And what happens is, suppose if this TPP is absent, then it will lead to accumulation of pyruvate, which will be diverted to form lactate. So we can say that the deficiency of P1 will lead to lactic acidosis. This is one of the very important clinical implication of TPP. Then second is it is a component of alpha ketoglutarate dehydrogenase. Again, oxidative decarboxylation. Here the reaction is alpha ketoglutarate will be converted into succinyl coenzyme A. Again, here this is the enzyme and TPP is one of the major coenzyme. So we can say that if TPP is deficient, then again alpha ketoglutarate or TCA cycle will suffer. That is why we say deficiency of B1 leads to mainly neurological manifestations. It basically affects the brain because TCA cycle is affected. TCA cycle, right? Then third is alpha keto acid dehydrogenase. This is an enzyme of branched chain amino acids. And branched chain amino acids, which are LIV. And when this enzyme is absent, there is increased concentration of leucine, isoleucine, and valine, which we have already discussed. And I can say that it leads to maple syrup urine disease. So I can say that first is conversion of pyruvate to lactate in the absence of TPP, or you can say pyruvate to acetyl coenzyme A. In TPP absence, it will be converted to lactate. Second is alpha ketoglutarate is converted into succinyl coenzyme A. Again, alpha ketoglutarate dehydrogenase, oxidative decarboxylation. Then alpha keto acid dehydrogenase, it is also known as decarboxylase also, because what happens here is pellet transamination is there, and after transamination dehydrogenation along with removal of carbon dioxide is there, and this leads to MSUD, maple syrup urine disease. And the fourth important enzyme for which TPP is the component is transketolase. Very, very important. Transketolase, which is an enzyme of HMP shunt. Because starting say I'm telling you, if you people have thoroughly understood the metabolism, it will be very easy for you to understand the vitamins, understand the functions of the vitamins. And if you can understand the function of the vitamins, you can easily correlate with the deficiency manifestations, right? So if we talk about B1, I can simply say that B1, whose active form is TPP, it is required for 4 major reactions in the body. And these reactions are oxidative decarboxylation. First is, it is a component of PDH. It is a component of alpha ketoglutarate dehydrogenase. It is a component of alpha ketoacid dehydrogenase, and it is a component of transketolase. And even if a child is suffering from MSUD, the supplementation of thiamine is given. Right? So these are the important features. And then the deficiency manifestations. Now, if we talk about the deficiency manifestations of B1, we can say that it leads to beriberi. Now, this beriberi is of 3 types basically: wet beriberi, dry beriberi, and third one is infantile beriberi. Right, if we talk about wet, here there is retention of fluid, so it leads to edema. Dry में mainly CNS manifestations are there, but no edema is there. No edema. And infantile beriberi is if the mother is B1 deficient. So automatically it will be transported or transferred to the child. And then the second important deficiency manifestation of vitamin B1 is Wernicke's या Wernicke encephalopathy. Basically what happens is, if a man happens to be an alcoholic and B1 is deficient, then what will happen is, if he is into alcoholism, if an alcoholic person is B1 deficient, it will lead to Wernicke's encephalopathy, or it is also known as Korsakoff syndrome. And basically the main symptoms of this is Goa. Just to remember this. Goa means he will be totally in a delirium type confused state, because brain is the one which is affected. Global confusion. O stands for ophthalmoplegia. There will be difference in the movement of the eyes, and ataxia. There will be a change in the gait also. So these are the deficiency manifestations of B1. And you can say that what is the laboratory finding or biochemical finding? One thing, we can check the presence of thiamine in urine. So we can check it, urinary thiamine excretion. And second is the most important one, on which the question has been asked, erythrocyte trans ketolase activity. Ketolase activity. So biochemical finding will be, one is we have to check the presence of thiamine in urine, and second is trans ketolase activity in erythrocytes is assessed. So if there is any change, if there is any deficiency, automatically it is going to be reflected in the RBCs. Alright, so this is vitamin B1. Right? TPP, the active form is this TPP. Then second vitamin is vitamin B2. Now vitamin B2 is also known as riboflavin. And if we talk about the active forms of riboflavin, FAD and FMN. Flavin adenine dinucleotide and flavin mononucleotide. Right, so these are the active forms of vitamin B2. Sources, we will say कि basically riboflavin is a type of milk protein, I should say, or you can say, we say कि color of the milk of cow, या cow's milk is yellow in color than buffalo's milk because it has more protein content. और राइबोफ्लेविन इज स्लाइटली येलोइश इन कलर, और इसीलिए हम इसको क्या बोलते हैं, वी कॉल इट एज वारबर्ग्स येलो एंजाइम. Now, if you talk about the reactions, there are so many reactions where FAD and FMN are used. Common reactions, I'll just write FADH2. FAD mein you can write the example of succinate dehydrogenase, which is a very important reaction. And if we talk about FMN, FMN mein we can write oxidative deamination. Oxidative deamination, where the enzyme is L-amino acid oxidase. So these are, तो you can say that SDH है, oxidative deamination है, तो you can just imagine the functions. Because what are the functions? If I have to just write the functions, I can say that they play a very, very important role in the redox reactions or oxidation reduction and reduction. And they are the component of electron transport chain also. Transport chain. Up now, what happens is, ये तो हो गया vitamin B2 के functions. We can say these are the functions. Then what we are studying is, we are studying the deficiency manifestations. So what are the deficiency manifestations of B2? Now, if we talk about the deficiency, this is a very important question which has been asked in the exam so many times. हमारे पास patient आता है who has fissures here, and then the color of the tongue has also changed. Then you can say कि he is having like kind of corneal vascularization also, and he has so much of dandruff on the scalp. So what can be the symptoms? What can be the deficient vitamin? So that is riboflavin deficiency. So what are the deficiency manifestations? We can say cheilosis is there, angular stomatitis is there, right? Then glossitis is there, then seborrheic dermatitis is there, and corneal vascularization is there. So we can say that deficiency of vitamin B2 leads to these 5 symptoms: chillosis, angular stomatitis, glossitis, seborrheic dermatitis, and corneal vascularization. Then we come over to the biochemical assessment. Now, if we talk about the biochemical assessment, the most important one here is glutathione reductase activity. Erythrocyte glutathione reductase activity. Basically, what happens is, this is very, very important. What happens is, this glutathione is present in 2 forms: oxidized and reduced. So it is converted from oxidized to reduced in the presence of NADPH, right? Here, what is happening is, here the enzyme is glutathione reductase. And you see that this glutathione reductase is responsible to convert oxidized glutathione to reduced form. Now what happens is, if this is in the reduced form, if glutathione is it in the reduced form, then only it will be converted, it will split H2O2 into water and oxygen, like this. And here the enzyme is glutathione peroxidase. Glutathione peroxidase requires selenium, but the important enzyme which is playing a very important role is glutathione reductase. Now see if there is deficiency of this NADPH, which is coming from HMP shunt, right? We can say that this glutathione reductase will not perform the function. If glutathione reductase is unable to perform the function, glutathione will not be in its reduced form, and then this glutathione peroxidase will also not be able to function. So what will happen is, there will be breakdown of this hydrogen peroxide. Ab hydrogen peroxide, water and oxygen mein to it won't be broken. In fact, this hydrogen peroxide will be released to form peroxide free radicals. And these peroxide free radicals have a tendency to digest, because free radicals ka function, what is the function of free radicals? They start damaging the cell membrane, because they have a habit of, because free radical they are in search of an electron. Wherever they will find an electron, they will just simply engulf that electron. So that is why whenever free radicals are released in the body, what will happen is, hemolysis will take place. And hemolysis, and that is why we say the enzyme which is required to produce this is G6-PDH. So G6-PDH deficiency will lead to hemolytic anemia. And the most important role played here is by B2. So that is why we always say, that is why it is written here also, कि glutathione reductase activity will be checked in the erythrocytes, and which will be a measure of B2 activity. So always remember, these two are very, very important questions which have been asked. And if I have to summarize B1 and B2, I can simply say that erythrocytic transaminase activity, sorry, erythrocyte transketolase activity. Activity is a measure of TPP or B1 deficiency and erythrocytic or erythrocyte glutathione reductase activity is a measure of riboflavin deficiency, B2 deficiency. This is very important. I'll just highlight it. Erythrocytic transketolase activity will reflect the concentration or activity of TPP, and erythrocytic glutathione reductase will affect the activity of B2. So always remember, vitamin B1, whose active form is TPP, is again required as a coenzyme, as you saw in so many reactions. And vitamin B2, again it is required as a coenzyme in so many important reactions. Then after vitamin B1 and B2, we come over to vitamin B3. Now, this B3 active form is, there are so many active forms. It is also known as niacin, but active forms are NAD, NADH, NADP, and NADPH. Basically, it is nicotinic acid. And this vitamin is the most important endogenously synthesized vitamin. Endogenously synthesized vitamin. And from where it is synthesized? It is synthesized from tryptophan, which is an essential amino acid. So we can say that 60 milligram of tryptophan is required to produce 1 milligram of niacin. And if we talk about the, you can say, the active forms, so what can be the functions? So many biochemical functions are there. Right, if we talk about the biochemical function, oxidation and reaction, you have seen so many reactions in which it is used as a reductant. Reduction reactions. Right, so many reactions. Matlab, if I have to name a few, it's like alpha ketoglutarate dehydrogenase, isocitrate dehydrogenase, alpha ketoglutarate dehydrogenase, then you can say 3-phosphoglycerol dehydrogenase, glucose 6-phosphate dehydrogenase. So many are there which are using NADH or NADPH. And the most important thing is it is synthesized by tryptophan. And this is a very important question, that 60 milligram of tryptophan is required to synthesize 1 milligram of niacin. Right? So these are the reactions. Then we come over to the deficiency manifestations. The most important disease which is caused by the defective synthesis of niacin is pellagra. Very, very important. Pellagra, which is characterized by 3 Ds. by 3Ds, which are diarrhea, dementia, and dermatitis. Right? Diarrhea, dementia, loss of memory, and dermatitis, skin. So the most important point here is to discuss about dermatitis, because what happens in dermatitis, photosensitive pigmentation. Photosensitive pigmentation is there. And what happens is, whatever area is exposed, whether it is the neck, whether it is the wrist, wherever it is exposed, there will be rashes. So we can say leads to rashes on the hands, on the neck. So when the rashes are on the neck, we call it as cassel necklace. So we can say that cassel necklace is a characteristic feature of a person suffering from pellagra, and it looks like this. Pigmentation is like this. तो अगर क्वेश्चन आता है कि द केसल नेकलेस इज ड्यू टू द डेफिशिएंसी ऑफ व्हाट, सो द आंसर हैज टू बी इट इज B3 niacin, which is synthesized from tryptophan.